Learning ECG with Dr. Sumit Jumrani. First of all, I would like to share why I had chosen this topic of ECG, the electrocardiogram. As doctors or paramedics, we all know the ultimate need for understanding ECG. Its importance is known to everyone as it is simplest, non-invasive, easily accessible, cheap source of diagnosing large number of diseases, not only related to heart but other systems too. My blogs and videos cannot change the need of standard textbooks, but it will surely help with all specific points to easily learn and to have a systemic approach to interpret a ECG. I hope my project will make good impression on everyone and will benefit us and society as it is a process of continuous learning. Electrocardiography is transthoracic interpretation of electrical activity of the heart over time captured and externally recorded by skin electrodes. In simple words, it can be stated as recording of the electrical activity generated by heart cells. Now let's see the uses of ECG. Chamber enlargement like left or right atrial enlargement, right or left ventricular hypertrophy can be diagnosed with ECG. Ischemia or acute infarction can be diagnosed with ECG. Gold standard for diagnosing tachy or bradyarrhythmias. Tachyarrhythmia related to supraventricular like atrial fibrillation, atrial flutter, AVNRT, AVRT, etc. Life-threatening ventricular arrhythmias like ventricular tachycardia, ventricular fibrillation, the bradyarrhythmias like AV blocks, first degree, second degree, complete degree heart block, etc. Electrolyte disturbances like hyper or hypokalemia, hyper or hypocalcemia. Drug toxicity or the effects of drug like digoxin, QT prolongation drugs like amiodarone, ranolazine, etc. ECG changes in cases of poisoning like tricyclic antidepressant, etc. Infection like myocarditis, pericarditis, or conditions like cardiac tamponade can also be diagnosed on the basis of ECG. Its another important use is to check the efficacy of the therapeutics like 90 minutes ECG after thrombolysis, giving adenosine in SVT, or reverting to sinus rhythm of AF after IV amiodarone. ECG is also used after the procedures like angioplasty, coronary artery bypass graft surgery, or after implanting a pacemaker, etc. ECG is also helpful in other diseases like hyperthyroidism, COPD, or stroke patient can present with the underlying atrial fibrillation, low voltage QRS for hypothyroidism, or T wave inversion and QT prolongation when the intracranial pressure is high, that is IC bleed. Similarly, ECG also has some limitations. It is a static picture and may not reflect heart problems at the time patient is not having symptoms. Most common is paroxysmal arrhythmias like SVT or VT. Many times ECG shows non-specific changes which may be present with or without underlying heart disease. A normal ECG does not completely exclude underlying heart disease. It should always be clinically correlated. A patient with effort angina can have a normal resting ECG. A patient with syncope can have a runs of VT on Holter monitoring. And finally, like, comment, share and subscribe my channel. Thank you.